Hello, everyone, and welcome to this crucial discussion on women's cancer. Today, we focus on the power of early detection, advancements in treatments, and the role of awareness in saving lives in this virtual section. Think Pink, Act Now, Screen, Fight, Well, organized by Voice of Healthcare and Cadila Pharmaceuticals. Despite medical progress, many women fear barriers to screening due to fear, misinformation, or lack of access. How can we break these barriers, especially in underserved communities? How do we ensure that innovations like genetic testing, precision medicine, and AI driven diagnostics reach everyone? Beyond treatment, cancer care must address emotional and psychological well being as well. Support system and education are just as vital as medical breakthroughs. We are honored to have Dr. Profession Ghanashyam Biswas, MD, DM, Senior Consultant Medical Oncologist, Sparsh Hospital, Bhubaneswar, Odisha, here with us today, who will share his insights and also latest advancements shaping the future of women's cancer care. So let's engage, learn, and work towards a world where prevention and early intervention make cancer less of a threat. Welcome, Dr. Biswas.
Namaskar. Thank you.
So, Dr. Biswas, why is early detection so critical in improving cancer survival rates? And can you share some real life cases where early diagnosis made a significant difference?
So teaching time saves life. So that theorem everybody understands. So this is not only true for cancer. This is true for any illness. So in reality in life. So since we are talking about cancer, so that importance is also here. So in women's cancer, so the breast cancer is today the number one cancer, not only in India but throughout the globe. A postmenopausal lady, suppose, has a breast lump, right? So postmenopausal lady, a breast lump of a 2 centimeter. So these 2 centimeter, when an individual feels, so this mammography, which is a screening modality, can pick up around 1 to 2 years back. So if this lady feels a lump and meets her doctor just out of interest, ki what is this, and go undergoes some tests and found to have a breast cancer, the likely chances this lady has a cancer which is an early stage where she can get away with a mammography, certain blood test, maybe surgery and some treatment. The same patient when ignores, and this involves a more part of the breast goes into axilla, there are nipple changes, there are skin changes. So we have seen, and lady has seen growing from stage one, two, three, and there are many, not only in the rural, in the urban, even in educated people, they come out with an advanced disease and they have been seeing the lump for a year or so. Because malignant lumps are usually a painless, whereas somebody who has a benign lump or infective, they are painful. So that's why they are addressed. But malignancy is usually a painless lump and doesn't cause any discomfort except feeling a lump on the breast, and then it gets ignored because it is not doing any harm to you. So this malignancy will only harm you or will have symptoms once the stage increases, and this mass involves the neighboring structures, maybe the skin, maybe the muscle, maybe the bone or nerves or vessels, and then somebody becomes symptomatic. By this time, the mass has gone up, and there are so many real life because now there are many organizations, many institutes where so ladies, even the males, they undergo a regular screening. So not only for cancers, routine blood tests, ECGs, ultrasound, and individuals or ladies of more than 40, they go undergo a mammography and you just pick up a lesion which is not even a centimeter. And I've seen these changes in last 1 decade or so. I'm thankful to those organizations who have taken these steps to take care of their employees, and it is a welcome step. The whole country should adopt. Every institute, whoever is possible, they should adopt. So this can be done on a basis of either the whole the employee pays or the employer pays, or this can be on a basis where 50-50%, and is good for everything. And we have seen these changes for last, I'm into medical science for last 35 years now, but I've seen these changes in last 1 decade. So we are seeing lumps which are less than centimeters, which was not seen probably in our times when I started my oncology career.
Right. Right, sir. That is rightly said that malignant lumps, they don't present with pain, and it's only when they, metastasize or they go to the neighboring structure, or they, affect the nipple or the skin. Then only, symptoms appear, and then patient believe that it's something, it's wrong. But because of the modalities like mammogram and other screening tools, now they are being picked up early. So I believe that there are certain barriers where, because of which women feel that they should not go in for regular screening with the help of these tools like mammogram and pap smear and genetic testing. So how can we break these barriers, especially in rural and underserved communities?
Especially for somebody who is into a premenopausal age or actively menstruating ladies. If somebody doesn't know when to do a mammography, so and then it can be a problem, because suppose somebody is menstruating or somebody has bled a few days back, and you try to convince this individual for a mammography, she has to go through a lot of discomfort because you have to compress the breast from up to down and on lateral to medial. So every individual who wants to go for a screening or who is going for a screening, they should know that, so the after the periods are over for at least 10 days, when the hormonal changes have come down, when you are not going to be discomforted. So once somebody has a bad or a unpleasant experience, so this individual doesn't go for a screening maybe 2 years or 3 years later. So that is one part. Second, in India we have seen, and we well understand. So हम तभी डॉक्टर के पास जाते हैं तभी प्रॉब्लम है, एंड देन उसके बाद हम सोचते हैं कि अरे डॉक्टर ने कुछ नहीं किया. So the problem is that we are not aware of health, so we take the health as a low priority thing, and then the question of screening is far away. So in our country, it is a symptom detected. If I talk about breast cancers or many other cancers, whereas is the Western world, or the world where we see a more affluent people, so they are screen detected. So that's the difference. So somewhere in the world there are screen detected, and somewhere in the world we see a symptom based or a symptom detected tumors. So that is the gross difference. Now coming to genetic, so genetic plays a role in cancer, but one should not estimate or overestimate that genetic is the whole issue. So cancers can have a genetic component, but heredity component. So genes, because all cancers are ultimately related to genes. So somewhere all these cancers are genetic, but somewhere all these cancers are not hereditary. Means, so there are neither so the either the horizontal spread or the vertical transmission of these disease, probably in 10 to 20%. What are those cancers? So breast cancers, ovarian cancers, pancreatic cancer, prostate cancers, and a colon cancer. So where if my grandfather or grandmother from either side has a cancer, then I had some chances. Or if I or my family has, then my kids have. So either, so this is important for these five cancers, and there are many other cancers. So where the role of hereditary cancers is important. So like somebody in a breast cancer, if somebody is young, menstruating lady, and especially very young means less than 35, somebody has a triple negative breast cancer. So one known, the known is a triple negative breast cancers. So these, in these cases, so practice of genetic test that is known as BRCA1 and 2, which Angelina Jolie had in 2013. So this is becoming important because in 2013 this test cost was a huge, more than a lakh of Indian currency. And today this test can be done and free in many government hospitals, and otherwise somebody can do it at a 10,000, 15,000 rupees of this test, and then you can understand, so are you inheriting your disease from your parents, or you are going to inherit this disease to your children's the generation next. So it is gaining importance. The one thing is because we now understand if these come positive, so what are the measures taken. Second, it is becoming affordable, and third, it is now major tier 2 cities and even tier 1 cities. So the tests are available locally. So that's the beauty of this part today.
Right. So the tests are becoming more and more available, especially the genetic testing you are talking about. And of course, we go in for, symptom detected cancer as compared to the screen detected cancer, as you have told. But I think we should break these barriers and, since the tests are available like mammogram, pap smear, and genetic testing, so go for it. My next question would be that many women fear cancer screening due to myths or misinformation. So, how can healthcare professionals encourage routine checkups without causing unnecessary anxiety? So, myths and misinformation, sir.
So means first thing is one should know know when to have the screening. That is important. The timing, the age is important. You are asking a lady of 30 years to do a mammography, and then you land up a problem. So 30-year a menstruating lady will have a fatty breast, and mammography is of no importance. So either you get away with an ultrasound, and if ultrasound is suspicious, so this individual will have to go for a MRI of the breast. So a mammography in such cases can be hazardous, because mammography will say something, and then which is not a gospel truth, and then the whole anxiety process starts, and then they meet an oncologist who advises for MRI, and then you find that it is only a fatty tissue. Somebody who is more than 40 years, more than 45 years. So when the breast have less fatty tissues, then the mammography sensitivity is more important, more easy. So where probably MRI, which is a costly affair, is not required. But for a young individual with a fatty breast, so mammography may not be the right thing, and then you pick up a false positive, and then it brings an anxiety, then goes through an anxiety, goes through several other procedures, and at the end you find that there is no disease. So this candidate may not go for further testing in future. So we should understand that you meet the right individual, right caregiver, or a physician. That can be your own family friend, or a city oncologist, and then you go through the procedure. So with one test, because many times we have seen, so these are machine generated reports. These are all copy and paste, and ultimately so किसी का report किसको दे दिया, and then the whole gamut. So be calm. If you find a abnormal report, just go cross check it, if that's the right report or not. And if that is a right report, then what are the next steps available before the panic button is stuck, and then you do you take steps which will be unnecessary and which can be hazardous to you.
Right. So, any kind of misinformation should not be, interpreted on your own. Go to a doctor and seek help. Right, sir. What are some of the most promising breakthroughs in breast, cervical, and ovarian cancers treatment today?
So we have come a long way. So at least I've seen the sea changes in cancer since 2000 and 2025, in these 25 years. So lots of options in cancer has come. So we talk about breast cancers. So we have improvised surgery from a radical, harrowing surgeries to now uh, organ preservation surgeries. So we are not removing the whole breast. We are not addressing the axilla, which is can always cause a brawny arm or the swelling of the arms, to doing a sentinel node testing. So we have come a long way in terms of radiations, from radiation, which was really a bad omen for many people, because of toxicities, skin toxicities, and thereafter long-term toxicities. Now we have come through 3D CRT, we have come through precision, we have come through cyberknife, and now protons are available in the country. So which can be a boon for those who can afford that at this point of time. Now coming to my own subject, that medical oncology, which is systemic therapy. So in breast cancer today, all patients doesn't require chemotherapy. If somebody is hormone positive, only 30% patients will require chemotherapy. So there are hormonal treatments. So there are targeted therapies for cancers like triple negative. So there is immunotherapy available. So I think so breast cancer has seen a lot of changes like lung cancer. So if I talk about lung cancer and breast cancer, so there is a sea change. Coming to our own problem is a cervical cancer, and today we know that it is it is caused by a virus which is known as human papillomavirus. So more than 9 out of 10 is caused by human papillomavirus. So you do a biopsy, put this sample for a DNA, HPV DNA, it will come positive. So that means so chronic HPV infection is the root cause of these infections. And the vaccine are available for last more than a decade, but today these vaccines are much more affordable, and even you know that the union government has made it free for 9 to 14 years. So I myself, being a doctor, being an oncologist, so I've given my daughter the first dose of HPV. So when she was 10 years, and somebody who is below 14 years, so two doses of vaccine can prevent more than 90% of cervical cancer in this vaccinated population in future. So at least one out of four patients which used to be contributed by India in cervical cancers number and mortality. So in this one decade, we have seen a huge drop, and probably next decade we'll see that changes. So who knows, maybe 20 years from now, so we eradicate cervical cancer from India and maybe from the globe once we put this vaccination schedule in our universal immunization program. So today we have eradicated smallpox. Today we have eradicated almost like polio, and why not cervical cancer, which is bringing so much of mortality and morbidity. So I think it is a matter of time, and it is a matter of that the country is moving ahead, and health is gaining importance, and so is the vaccination.
Right, sir. So we have come a long way as far as these two cancers are concerned, like the breast cancer and the cervical cancer. With breast cancer, we have the immunotherapy available for triple negative, and for cervical cancer, we have the vaccine available. Right, sir. So we have certain, screening tests which are home based and which are like non-invasive screening method for women cancer. What do you think about those screening methods?
So we are also a part of like thermomammography, because we know that we have a mixed population. So it's a huge country, and so many individuals shy away from screening. So there are non-invasive thermomammography, so which is promoted throughout the country. So like on occasions of women cancer, or even on Daughters Day or something. So on these occasions, we try to motivate a group or a society to go through this screening, either through the volunteers or at a minimal cost. So these are non-invasive. So this only picks up the thermal changes in the breast, and the patient or the individual has to sit in a AC cool chamber, and then so these temperatures changes are recorded, and then we categorize that if this patient requires further testing like mammography or MRI from there, or this patient doesn't require anything, so this patient screen detected that there is no evidence of cancer. So, so that helps out at least the in a routine in a mass, because these are portable machines, because usually the standard mammographies are not portable, and these are invasive procedures. So you have to be waiting, that you may not be able to do those within the 10 days of menstrual cycle. But so these procedures like thermomammography so takes away all those hitches, and it only helps you that will this patient require further testing or not. So lot of patients on this screening will will be just clear that they don't require further testing.
Right, sir. So I believe that thermomammography is one new thing you have, told us, and the viewers can, get themselves tested with the help of this, which is a very good method, non-invasive method, and is available thermomammography. Right, sir. So are there specific lifestyle factors that women, often overlook but can significantly reduce their cancer risk?
So do you think that the cancer is a new disease? So cancer is not a new disease. So cancer was there, is there, and will be there. And so it has gained importance, and you're seeing each household has or a nearby there, so it has a cancer. So one of the rise in cancer incidents is not only my thinking, but the whole community thinks. So one of them is that we are empowering our women, right? So they are now into institutes, they are into working, so they are into all the armed forces everywhere. So now the marriage age is getting delayed. The child birth for the first pregnancy is getting delayed. And most importantly, so any institutes gives us 6 months of maternity. And and you'll be surprised to see females joining, or their employers probably threaten them to join within 3 months, or the service is gone. So what happens? So they have a breastfeeding which is minimum. So breastfeeding protects a woman from many diseases. One of them is a cancer. One of them is an obesity, and there are many benefits of the mother. We are not talking about the benefit of the child, but the mother benefits with many cancers, and one of them is a breast cancer. Somebody has well fed for uh, her baby for 2 years from both the breasts, so she has a very less chances of getting a breast cancer. Besides that, that keeps the mother in shape. So one of the reason for obesity, increasing obesity, is also lack of breastfeeding. So breast cancers have a non-modifiable and a modifiable risk factors. So non-modifiable, that you cannot modify the age of the patient, you cannot modify the sex of the patient, you cannot modify the patient's family history, who has a strong family history of cancers. But what you can modify is that right time childbirth, adequate breastfeeding, and keeping yourselves fit enough according to the body surface area, that is BMI, and less amount of intake or avoid alcohol and tobacco. So which is more important. And you see our society, you can, because I see in our areas there are institutes where you'll see more of our girls are smoking and taking alcohol than the boys today. So the whole community is changing, and this is for 10 years from now, 20 years from now. So this is becoming a bigger risk factor. So we have westernized ourselves, we have taking pride in that, and which is not good for the society. And these are various reasons, and these are proven reasons for the increase in the incidence of cancer, and especially breast cancers in premenopausal women.
Right, sir. So, correctly said that we should, maintain our weight. Obesity is one major factor. Breastfeeding is always advisable. It protects, and of course, we should consume less of alcohol. These are the lifestyle changes which women can make to be healthy overall, not only to reduce the risk of cancer. Right, sir. So, with advancement in cancer research, do you see a future where, in few cancers would be fully curable or preventable? Preventable, we have talked about cervical cancer. Do you believe that any cancer would be fully curable?
So if any cancers that will be probably preventable in future, so in my probably life tenure, so that can be a cervical cancers. So the government has been proactive, and once we as an individual caregiver or as a citizens of India, we become proactive and we start vaccinating our own girls at home, and then probably we can see at least a cancer free world for cervical cancers. So as I initially said, so 25% of the global cervical comes from India, and it is a huge toll. So I think so that will be a boon for our daughters and our girls, that will eradicate one cancer at least. And with that help, so HPV not only causes a cervical cancer, so HPV can, because HPV comes through a penis, so the source, the semen, and so it can also reduce the incidence of anal cancers. It can also reduce the incidence of oral cancers which are non-tobacco related. So our population is tobacco related, whereas in the Western world you see a lot of oral cancer which are HPV, because of the sexual practices prevalent there. So I think so. So not only one cancer, so we are going to target at least three cancers: cervical, anal cancers, and oral cancer, which are non-tobacco related. If you start vaccinating and eradicate HPV.
Right, sir. So there are three cancers which are related to HPV, cervical, and of course oral and anal cancer, which are saying, and definitely we can target these. Right. So my concluding question would be that what advice would you give to a woman of today? How can they take charge of their, cancer risk and overall health?
So this women's day, and so we say that we have been empowering our girls, we have been empowering our women in the society. So that doesn't mean that we forget our grandparents, grandmothers, and what our mothers have done that. So, so right time for a marriage, right time for the first baby, and however busy you may be, so you get a lifetime opportunity to protect yourself and protect your child from many diseases. If you the importance of breastfeed cannot be replaced by the packet or the tin foods, the commercial foods that's available. So if you can understand these basic things in life, so many problems are going to be solved. So people are there, people are there to take so westernize. So why not be yourself and see. So we have, our diet contains so much of antioxidants, so much of dahi curd, also probiotics. So there are many reasons that we don't get much of a colon cancers as compared to the West, because our natural diet has lots of haldi, which is in turmeric or antioxidant. So lots of milk products, including the dahi, so which is a probiotic. So these are certain things, if you understand today, so which may not be applicable for those packeted foods which are stored or smoked, which is going to have lots of carcinogenic, not only carcinogenic, but they are going to be in a long term causing many diseases. So if you understand those basic things, so I think so there is many of these problems can be addressed.
Right. I think maintaining a good lifestyle and, of course, breastfeeding, getting yourself screened, and making use of the thermal mammography, which you have, enlightened us with. One more thing, that what all practices are you, doing in your hospital, wherein you are attracting more and more patients to get screened? Few tips.
So first thing that, so if I preach, then I have to be on the I have to be in the society that people can follow me. So if I say something on the screen and I do the opposite way, so nobody is going to follow you. So when I vaccinated my own girl, so I posted it, so that, so if I can vaccinate, why not you? So that is the, so if my wife can go through a mammography, so why not you? So that is the, so the whole thing starts from your home. So you start following these practices for your woman at home. So it can be your daughter, it can be a wife, it can be a mother and a granddaughter, and grandmother. So if that can be done, so if I'm 50 plus, if I do for a screening for a prostate, so if I start doing that, and my medical community does that, so I think so many of these jobs will get over. And if I speak only on a women's day or a Valentine's Day and a world cancer day, so it just doesn't make any impact, because it just, you listen, and the next you are out of the hall and you just forget. So unless and until somebody has seen a suffering of a cancer patient, somebody has been involved in the cancer treatment. Otherwise, people think that and this also happened during the COVID times. People think that this family got COVID or cancer, so I'm immune to this. So nobody is immune to COVID, so nobody is immune to cancers. So probably risk factors and a family the predisposition is going to increase, is that. Otherwise, if you have no addictions, if you have no positive cancer family history, but you are still not immune for cancers, so you have genes, you have cancer genes, so it takes a matter of time these cancer genes to become active. So it are proto-oncogenes, the tumor suppressor gene, the balance is lost and we get cancer. And that is the reason that we are seeing many women are suffering from a lung cancer, although they are not smokers. And that is the now the tragedy, and it is a surprising thing for the whole community, oncology community, that in 10 years the incidence of female lung cancer is a huge, and they are not smokers. So there
Right.
is a lot to be incorporated because of the environmental pollutions we have, and maybe a passive smokers, somebody is at home. So this is probably contributing a bigger thing.
Right, sir. So, on that note, I think I'll conclude the session. Thank you so much for joining us today.
Thank you so much. Thank you so much.